Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Thank you, everyone, for listening to AUA Inside Track. I am Dr. Justin Dubin, a men's health specialist in South Florida.
Guys, I'm Dr. Rena Malik, urologist and sexual health expert practicing at VA Long Beach in California, and we are your hosts today. We're going to be talking about something that is so important everyone needs to know, and something, frankly, we love talking about: sexual medicine.
That's right. I mean, in honor of Sexual Health Awareness Month, we're breaking down the top 10 things that we wish all urologists knew about sexual medicine. So, Dr. Malik, why don't you start it off? What's number one?
So number one is, I think when men come in for erectile dysfunction, it is a huge opportunity for us, right? These guys, one, are so motivated to improve their erectile function. And I think we don't talk about lifestyle changes enough. And I think if you told a guy, and I do it all the time, you tell them, optimize your diet, optimize your exercise, reduce your stress, and you're going to improve your erectile function. This is where they're going to actually do it because they're so motivated.
Oh, I agree 100% with this. And one thing that I like to tell my patients is if you want to keep having a good, long, satisfying sex life, you need to do the other things like taking care of yourself and optimizing yourself in the ways that you've discussed. You know, people are, for better or worse, we think with our penises sometimes. And I do think that if we can find other ways to showcase how their sexual health and their erection health is about other aspects of their health, we can really motivate men to get their diabetes under control, to get their blood pressure under control, to lose weight. So I agree 100% with you there.
Yeah. Why don't you tell us number two? What is your number two thing that you think people need to know about?
Well, I think that you kind of, just to piggyback off of yours, I think that sexual health is not just about erections, actually. So when we're talking about sexual health, there's other things you really should be considering, especially as a urologist. We're talking about ejaculation, libido, pain with sex, sexual satisfaction. And, you know, these are things that are going to be impacting or being impacted by a lot of things that we as urologists treat. So I think we have to think more broadly when we're thinking about sexual health and not just be so focused on erections.
Yeah, I'll add number three, which is you have to ask those questions. So
Yes.
I know that we are sitting here telling you all these things, but if you don't ask about ejaculation or orgasm or sensation or pain, they will often not tell you. And then you're leaving stuff on the table. So make sure you ask those questions. And yeah, it takes time. I get it. We don't all have a ton of time. So I actually put a bunch of that in my intake form so that I can flag it when they come in and we can talk about it more deeply. But at least I've asked the question and they know it's coming, right? They know I'm going to ask about these questions during my visit with them. And so they're primed and ready to talk about it.
Absolutely. I do the same. I have a lot of these questions on my intake form just because it's easier. You know, you can prompt yourself to discuss it or at least bring it up. If it's something that you really don't have time to actually ask all of these questions in your office. And I think that this naturally comes on to number 4, which for me is even if you don't treat sexual health issues, you know, you need to understand that your sexual health can be impacted by your urological treatments, even if you're not in the specialty of sexual medicine. And we're talking about things from BPH to cancer treatments to pelvic health. You know, sexual health is really impacted in a lot of the interventions, whether it's a surgical treatment, a medical treatment, and you really need to consider these things when providing interventions. I can't tell you how many patients that we've all seen who have stopped medications like tamsulosin because it's, even though they have a satisfactory result from their urinary perspective, they're developing retrograde ejaculation. Or how many people get BPH surgeries based off of the ejaculatory sparing aspect and consider active surveillance or potentially a little bit more aggressive procedure based off of the sexual health implications of the interventions. And so you have to think about sexual health because that's how your patients are thinking about the ramifications of whatever treatment you're offering.
They won't be happy. They might not even bring it up to you, right? But they're not going to be happy when they didn't know they had going to have retrograde ejaculation and now they do. And some of them might not care, right? Of course, but I think they're not going to bring it up to you necessarily. And they might stop using the medication and then they're actually just worse off. So I think it's also good to know alternatives, right? Like, for example, I often will prescribe alfuzosin because it has a lower rate of retrograde ejaculation than tamsulosin. And I offer both to patients to say, look, this one's maybe a little more effective and this one maybe has less retrograde ejaculation, and they make the decision. So, and then I think that goes naturally into number 5, which is, review their medications, because there are so many medications that cause issues with sexual function, like antidepressants, certain high blood pressure medications. And it's not a very difficult fix to say, hey, talk to your psychiatrist or your primary care doctor. This medication might be contributing and perhaps you could switch it to something else. And you look like a hero. At the end of the day, you've literally done something so simple. But a lot of patients feel like we are just obviously very focused on what we're focused on, which is urology. But when you look at the patient from a whole perspective, they're going to be grateful, and 2, they're going to be like, oh, you really care. You're looking at everything. You're paying attention to the details.
Yeah, and I think that this is really big in a lot of patients who come to you for a first time, and they kind of are fumbling themselves with how many medications they're taking. They don't understand the impact or the implications. If you can really guide someone into the treatments that they're currently having, or the other options or potential reasons that they may have these issues, I think it really goes a long way, and they really do appreciate it, because you are looking at other aspects of not just the person in the room, but the things that they're doing and that they're taking and impacting their bodies. And honestly, that goes into my next one. And it's amazing how these are naturally flowing together. But the truth is, it's all connected, and it goes back to this holistic idea. And my next one, I think this is number 5. I don't know, maybe
5 or 6.
Maybe 6. We're so into it, I don't even know the numbers anymore. But it is that sexual health and mental health are really closely connected. If your patient is having sexual health issues, you really need to address the potential psychosocial issues as well. Now, I'm talking about not only about how their erections or their erectile dysfunction or the sexual dysfunction makes them feel, because obviously that can trigger worsening sexual health, but the inherent, life stressors. Are there new things going on in their lives? Are there issues with their relationships? Are they suffering from depression or the medications, like you mentioned before, that are impacting their sexual health? And I think it's really important that no matter if you're a sexual health physician or a focused urologist or not, you should have a good relationship, or at least a good referral base, for a therapist, a sex therapist in your community that you can refer your patients to, because that is going to be such an important component. I can't tell you how many patients I refer to therapists, sex therapists on a daily basis. And sometimes it's hard to actually get them to go. But in the sexual health space, I think you can really let people see or introduce them to the idea of how important your mental health is to your sexual health, and really get them that motivation that they need.
Yeah, I would add to that make sure you're asking about also their practices like masturbation and pornography. A lot of people hold a lot of guilt or shame for those things, and that can really create havoc on their mental status in general too. So I think that's important to discuss in that specific situation. My next point was one I learned from Dr. Mokera, but we know that low testosterone can improve mood, right? Can improve symptoms. But if you look at the symptoms for low testosterone, the symptoms for depression, they're pretty much identical. And so oftentimes, just like we should be having maybe our psychiatry or primary care colleagues screen with testosterone, we should also be screening our patients for depression. So doing a screener of some kind, if you can include that in your paperwork, particularly if they're there for symptoms of low testosterone, I think is really relevant, because yes, the depression can be a result of their sexual dysfunction, but it can also be separate. And it's another sort of place where we can, intervene in a way that might improve their overall quality of life.
For sure. I think that is something that I'm always asking. It's on my intake. I am always asking about their mental health. And whether they're having signs and symptoms of depression, we're talking about it. And I'm always bringing it up on pretty much anyone who either comes in for erectile dysfunction, new ejaculatory issues, or low testosterone. Because, especially in a lot of these things, when you see new onset of issues, I'm always asking, has anything changed? Has your perspective or how you're feeling changed since these things happened? Is there a trigger here? And oftentimes you can find something, especially when it comes to things like premature or delayed ejaculation, which do have a very a mental health component associated with acquired more than congenital. So really excellent points there. The next thing that I think of is something that is more generalized, but we've kind of been bringing it all together to this idea that sexual health is health. I know we really need to make sure that, when people are coming in, we are screening them for potentially other things. I can't tell you how many guys come in as 45, 50-year-old men, and they come in and they say, I go, how many medical problems do you have? And they say, I have no medical problems. They get screened. Their vitals are showing that they're hypertensive, they're overweight, they have erectile dysfunction, which is why they're coming, but they haven't seen a doctor in 35 years. So the reason why they don't have any health issues is because they've never been worked up. And I can't tell you how many times I've diagnosed people with diabetes, high blood pressure, other health issues. And so you really have to take the opportunity to understand that oftentimes you're the gatekeeper to that person that is coming in. They're coming in for one thing, but you really need to make sure you're navigating and checking them for other things, cholesterol. Sometimes I've done the full workup and I've almost acted like a primary care, and you can motivate those guys to finally establish care with a primary and start navigating their health a little bit better.
Absolutely. I see this all the time. I mean, I'm in Southern California. People come into me, they're super fit. I mean, you're in Miami, you see this too, right?
Yeah.
They're super aesthetically look like the specimen of health, but they all have either high blood pressure or high cholesterol, and they had no idea, or they were misinformed and thought it wasn't a big deal. And so this is a great opportunity. I think, again, we really can be, you don't have the time to be a primary care doctor, but we can be someone who helps them get the care they need. And I think that's really, really valuable. And, that really does save lives in the long term. I think that the other big thing is, if you don't know, say you don't know. I think the worst thing is that when patients come in, especially like females, we see this a lot. A lot of people don't have a lot of knowledge about female sexual dysfunction. So they'll come in saying, I have low libido, I don't feel like myself. And the doctor will be like, you're fine. Just you need to de-stress your life. And that feels very, sort of like, yeah, they probably do need to do some de-stressing, but they do deserve a further investigation. And so I think ultimately, if you don't know, refer them to someone who does. Find someone near you who's an expert in sexual medicine, female sexual dysfunction, menopause, whatever you're not comfortable handling, and refer it to them, because it's okay to say, I don't know. I say, I don't know all the time. I say, look, I don't know. Let me find out for you who can do this, or maybe I'll look it up, or I'll ask an expert to find the answer. And I think that's totally appropriate. We're not going to know everything.
I think that is such an important one, and that was going to be my last one. So congratulations, you stole it. But no, I think it is important, because first off, a lot of people read stuff online. They understand, they're coming in with some kind of knowledge base, and they're asking sometimes pretty deep questions. And if you're not knowledgeable, or it doesn't mean that you're not knowledgeable, but I think making stuff up and is way more harmful, not only to your patient, but also to you and the trust that you create with your patient. So saying, I don't know, I think is so, so important, and understanding what you do and don't know, and leading people into the direction that they need to go in is really key. And I guess I'm going to naturally flow into the next one, which really is, if you don't know, other than having a good provider, have some good resources to point to your patients in the direction towards, because as Dr. Malik and I very much know, there is so much bad information out there. And there is a lot of good information too, but it's shrouded by all of this bad information. So we have some excellent AUA websites. We have SMSNA websites. We have ASRM websites. There's some really good valid data that patients can go use. And I think having those resources at your fingertips, using Dr. Malik's podcast, using my podcast, shout out to, Kelly Casperson. We have so many excellent people in the space, Backtable, that you should be able to at least have a referral either for yourself for good information and your patients.
Yeah, and I'll add, check out the guidelines, right? The AUA guidelines are so helpful, right? Testosterone guidelines, now ejaculation guidelines, testosterone guidelines. Like there's a lot there. And literally, they've done the work for you. They've taken the evidence, they've summarized it, they've told you what's good, what's not good. And I refer to them still. Like I'll be like, oh, what's
all the time.
One of my patients, for example, one of my patients recently was like, oh, I did Potaba for Peyronie's. I was like, Potaba, I didn't think it was not in the guidelines. I went back to look at the research on Potaba based on the guidelines. Like, oh, there's some data, it's very small. And I was like, okay, so I told the patient, and I was like, yeah, it's not unreasonable, but there's not a ton of data. But I had to then, go back and look at that. So I think it's really useful to have those saved or easily accessible. And there's usually algorithms and stuff that make it so easy to just do the work.
No, it's really important. I also wanted to give out a shout out to Dr. David Keynes too. He also showed me this really great website called Elicit, ELICIT.com for all providers. And basically it is a PubMed meets Chat GPT, where you can ask it a question and it will create an abstract from PubMed papers, and it will actually show you all of the publications that you can go back and read. So I think it's a really good resource for physicians who in a pickle may have a quick question that's really you may need to do some research on, and it's a good resource for that. So I always will recommend, I've been using it a lot. So I wanted to give Dr. Keynes a shout out there because it's a great tool that he has been talking about for a while.
A couple other similar ones are Open Evidence and Consensus. So those are also great. Open Evidence is an app, so I like having that on my phone. So yeah, there's going to be a ton of things like this emerging that will help, when you have a quick question, you don't know the answer. So use them, right? They're there for our benefit.
For sure. I don't know, any final thoughts, comments, on Sexual Health Month? I mean, I think that one thing that we really need to do is continue pushing it, as you've been doing amazing work, Dr. Malik, over the last few years and really helping normalize good quality information. And I think that it takes a village. And I think we really need to make sure that people are asking the questions, asking the right questions, giving information like we've been talking about today. And it doesn't have to be the whole visit. It can be a 5-second, 2-liner thing where you're referring to someone who does know the information or can provide that help.
Thank you. And your podcast is a great resource as well. You guys interview so many wonderful experts in the field. And I would say that, again, sexual health is health. We can't say that enough. And really just empowering patients, even if I still ask patients when they'll come the third or fourth time, I'll be like, still having any issues with erections, like anything you want to talk about. I still bring it up, even though they're established patients, because things evolve over a lifetime. And it just creates opportunities. So I think, we are so fortunate that patients come to us, talk to us about these intimate things, and we really have such an opportunity to do great work. And I think everyone out there is doing a great job in the confines of our current sort of medical system. And I think just keep doing it, because we're really doing a good service for people.
For sure. Well, thanks to our listeners for joining us. For sure, this was a wonderful conversation that I had with you. I always have a great conversation with you, though.
Me too. It's always fun. So stay tuned to the next episode on staying sharp and how to continue your learning after residency.
This has been an AUA News Inside Track podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.